recorded. Thank you very much. All right, everybody. Thanks for being here at the RSV 2022. This is our first breakout session of the event, one of three, and you are currently in 1B, which is lessons learned from swing bed patient experience. And so Kansas State Flex Program and HealthWorks will share information on a project available to Kansas hospitals focused on swing bed patient experience. In addition to gathering patient feedback, this project allows hospitals to share best practices and network with hospitals in Kansas and other states that are using similar process. At the conclusion of this presentation, participants will be able to learn how participating in hospitals have built the community's knowledge of their swing bed program and market to potential patients and referral sources, and understand the mechanics of the project specifically impacting to participating hospitals, lessons learned, and plans for future expansion. So we have two people that will be presenting, and then a guest hospital perspective. And so I will introduce them right quick, and then they can take it away. And so presenting today is Susan. Susan Runyon started her own consulting firm in 2016. Is that correct? Yes, 2016. And I lost my screen. She primarily assists critical access hospitals with quality improvement activities and programs along with quality data reporting. She has 14 years in hospital risk and quality management with 30 years overall, a variety of healthcare roles. She has worked with the Kansas Quality Innovation Network Quality Improvement Organization for 3 years and has contracted with them recently to assist when needed with their CMS scope of work and beyond. She's also worked with the Kansas Hospital Improvement Network, and she has been contracted as the MB Quick Contract Coordinator for Kansas Critical Access Hospital. She has served as a board member for the Kansas Association of Healthcare Executive and is the former president of the Kansas Association of Risk and Quality Management. She holds a Master's of Healthcare Leadership from Friends University and a Bachelor of Science degree in Healthcare Administration from Southwestern. She is a green belt in Six Sigma and in healthcare from Villanova University. And then we also have Andy, or goes by Andy, so we'll just go with that. Andy serves as the grant program analyst for the Rural Hospital Innovation Grant in the State Office of Primary Care and Rural Health within the Kansas Department of Health and Environment. Through this role, Andy is working closely with rural hospitals across the state to help provide grant funding. He has over 20 years of experience in healthcare and 15 years working with hospitals of all sizes. He has a Master's of Education in Health from the University of Kansas and is currently pursuing a graduate certificate in epidemiology from the University of Kansas Medical Center. And with that, I will hand it over to you, Susan and Andy. And please, everybody, if you have questions, feel free to put them in the chat or raise your hand, use the raise your hand feature, and we'll be happy to do that. If you put it in the chat, I'll try to chime in and make sure it gets to the right place. So thank you for being here again, and we look forward to your participation. And yeah, Susan, take it away.
Well, Andy's going to start us off. So Andy.
I'm sorry, Andy, take it away.
Susan, thank you. No problem. Like I said, I am Andy Jones. I am, in addition to overseeing the Flex and Ship programs. I'm also the manager for the Rural Hospital Innovation Grant that was newly established here in the State Office of Primary Care and Rural Health, which is housed within the Kansas Department of Health and Environment. In addition to participating in SOAR, obviously, in the Flex and Ship programs, we are also the PCO grant recipient for the state of Kansas. So we have the honor of serving the little over 2.9 million residents in the state of Kansas over the radius of 105 counties. 89 of those counties, roughly 85% of the state, has some kind of rural or frontier designation. And that's where about 37% of the state population resides. Kansas is largely agricultural. So that rural population relies significantly on agriculture and manufacturing. As you can see here, there's 123 total hospitals in the state, but 82 of those are critical access hospitals. And so Kansas, like many states, has an aging population. Some areas as much as 30% of the population is over the age of 65, and has a disproportionate number of individuals who are uninsured or underinsured. We at KDHE and the Office of Primary Care and Rural Health have really had the privilege of having a unique collaboration with the Kansas Hospital Association and HealthWorks really since the very beginning of the Flex program. HealthWorks, along with Susan, do much of the outreach to the hospitals and provide them with the TA, along with administering a lot of the projects that we run through Flex. And that includes the swing bed project that we're going to talk about today. So with that, I will hand it over to Susan, and please utilize the chat if you guys have any question or comments specifically for Susan or Katie. And with that, Susan, take it away.
Thank you so much. So Jennifer Finley joins us as well. So she can answer maybe a question or two at the end if you have questions on the programmatic side. But I want to talk really about how we got started in the swing bed arena. We developed a work group years ago to try to figure out kind of what the needs were for the swing bed hospitals and kind of what we could spend some funding on, basically. So in that work group, we really established the original focus was how can we show value to PPS hospitals and our communities. And our work group decided to work on patient experience, quality measures, and then cost and value of swing bed programs. So when I'm focused today on patient experience, knowing that the other two are in the works or under development in this work group, but the focus today is on the patient experience aspect. So obviously knowing that swing bed programs are a large population of critical access hospitals, they were felt like they were missing the mark when the majority of their folks weren't receiving surveys or surveys that weren't really focused on the swing bed programs. Maybe they could add them to the HCAHPs if their vendor would let them, but they really wanted to hear from the programs themselves and the patients who were participating in those and what they could do better in different areas. So obviously hearing and understanding what the patients value and what matters to the patients and how it applied to them or didn't apply to them or how they heard about the program, all those things are what really this project is about and why it was important. We started this way back in October 2019 to August of 2021, we did a work group pilot. So that work group decided that they were going to work on patient experience, and probably without COVID, we would have pushed this out to our state maybe a year before, probably. I would say we would have done it for a full year with expectations that we were planning to roll it out in 2020. And that obviously we didn't feel that was the right timing. So we did till present. So September of 2021 to present, we did a statewide rollout, added a few hospitals, basically then still stuck with our vendor. Survey Solutions is who we use, and we're going to talk about them, and I'm going to show you some graphs from their dashboard. We have 13 hospitals, critical access hospitals, that are participating. It's a short survey, 14 questions. I'm going to show you what it is. They primarily use a tablet so that they really get the data collected at discharge. They automatically load to a web portal so that they can have reports and access to those things. We also do a monthly huddle, and we've been doing that since the beginning of this work group. Back in, I want to say, the spring of 2019 is when we first started. And so that monthly huddle is huge. But I want to show you quickly kind of how far we've come since 2019. We started with, I told you there were 14 questions. There's 12 on this screen. The other two are, did anyone help you complete this survey? And then an open comment question. But I did want to provide the 12 questions. And you can see that they're sectioned into like transitions in care, staff engagement, into the measure sets. And so that's how the results that I'm going to show you before we move into kind of how it's reported. So in 2019, for this, staff gave an understandable explanation of services within the skilled program. We in Kansas were at 76% of our people saying always. And by 2022, we focused on it, and now we're at 94%. You can see the national averages below. So anyone else across the nation, and like I said, these are Survey Solutions graphs that are on here from the dashboard. So the national averages would be anyone else who's a Survey Solutions swing bed program patient experience participant. So that's the national average. The staff engagement has the 4 questions there on the side about nurses and therapy staff, talking to them, explaining, involving them in their care and explaining what they're going to be participating in. We were at 80% in 2019 and we're at 88% now, so right along the national average. The experience in care, this is about activities, involvement of bathrooms, getting them to the bathroom in a timely manner, and then involving them in their treatment plan and goals. We were at 69% when we started this, and we're now at 84% for our state average, which is close to the national. And then we made a huge leap on the needs of our patients, and then the therapy and information provided for discharge, dismissal, things that they needed when they left. 59% back in 2019, 82% in 2022. And this is overall rating of the hospital and recommendation, so similar to an HCAP type question, 77% compared to 85% currently. So I wanted to show you kind of how far we've come just by focusing on those interests, as well as the limitless volume of comments. I will say for some reason people love to comment on this particular survey, and some of the comments are tremendous, provide great insights. We do have our monthly huddle. If you're thinking about offering something like this, the benefits of this type of program, I would say one of the greatest value adds is that we have this great network now of our work group, and the monthly huddles are huge. We talk about patient experience, we talk about our quality measures, we talk about best practices and kind of just how others have solved any kind of problems that they may have encountered. Gives great support and encouragement, some marketing tools. I'm going to show you on the next slide. We've developed that with marketing through the Kansas Hospital Association and our work group helping structure. So when they get a good comment on a patient experience or they get percentages, we actually have a template for them to apply and utilize for marketing purposes. Obviously, the ability to compare to other state critical access hospitals and then other hospitals, critical access hospitals across the nation is important, just to kind of measure where you stand. So our work group needed some marketing materials. They needed 2 kinds. One, they need to market to referral sources. So PPS hospitals, kind of what they offer, that they want their patients back, and even to the community as a whole, kind of what type of things are available. But these went to this particular material. They could put their percentages in, they could put their services. If they didn't offer something on there, they could take it in and take it out. We made it a Word document, so very easy to manipulate and make it their own, and to actually utilize some quotes from the patient surveys. And then they were to send this to their physicians and then their referral sources, PPS hospitals around their area, so that they were aware what a swing bed program even was. Because that was one of the things we found out, that they might not even know what a swing bed program was. The other piece that we're finishing up for them as well is some marketing material or tools for their patients or their consumers and the community, so that they know what's offered and that they can take it even to if their mother falls and breaks a hip and has to go to a PPS hospital, but could come back to their critical access hospital for services in their swing bed program, then they would even know that it was available. So marketing tools have been a big, nice takeaway advantage as well. I wanted to talk briefly about survey solutions and kind of why our people chose to partner with them. So real-time surveys are done, like if they were done today, they would upload to the dashboard tonight and they would be able to see all results tomorrow. The response rate, because it is right upon dismissal, or I think most of ours honestly are doing it the day before dismissal or the morning of, so that the patients aren't tired and ready to go. So I think that that's a best practice lesson learned. So 70 to 90% response rate compared to an HCAHPS of around 30 or so percent. Involves departments other than nursing. And so many times, therapy doesn't have maybe a component. And right now on the side, we're piloting some dietary questions as well. But I didn't share those because that's a pilot situation. So, our hospitals are even benefiting from 3 additional questions around dietary questions. They're rural relevant, things that are appropriate and applicable, and obviously, like I said, involve a majority of their patients. They can benchmark it against other similar hospitals. And then the reports, like I showed you just briefly, and I'll show you a couple more reports. They're easy to share and easy to find and easy to generate. It's affordable for smaller organizations. The open comments are very informative. They add a lot of detail, things that you could actually drill down. And the nice part about it is it's so manageable that all of our hospitals maintained participation during the entire pandemic. Nobody missed a beat. I think maybe there was a month or so where we have somebody who just couldn't do it because they were pulled to another, priority. But for the most part, everyone, in fact, I think probably 95% maintained they were able to manage it during the entire pandemic. So that was important as well. The tablets, like I said, you get tablets, that all you have to do is hook it up to Wi-Fi. You don't need IT to take care of it. You just stay logged in. They're locked in kiosk mode until the person lets them out. Training's available. These are some more dashboards that Survey Solutions has. And, definitely easy to navigate the website. But I thought rather than just hearing from me and Andy today, that we would have an actual participant join us today. So Katie Wilson is here. She's from a hospital in Emporia, and she is just one of those very active and vocal folks. And I thought, what a perfect opportunity to see if she could join us today. So I asked her to come up with some bullet points on really the value of participating in this project. And then after she gets done talking, I'll tell you kind of how we really rolled it out and what kind of it takes to roll out this type of program. But Katie's going to spend just a minute or so talking from her perspective of the value of participating. So Miss Katie, we're ready.
Hi, my name is Katie. I'm from Newman Regional Health in Emporia, Kansas. So the value for Newman specifically, we were able to see from a patient's perspective, what they see as our strengths and weaknesses and how we can improve that so that their experience is a more positive one. So for instance, therapy, they weren't getting a lot of feedback on what those patients, how they felt that experience went. So I share those comments that patients leave on those surveys, and that shows our therapists what they can improve on to improve their program as well. It just, like I said, it just allows our patients to give what they would like to see in the swing bed program, what they would like to be able to experience while they're there, with a goal of them going home from there.
So you actually get the feedback that you need versus maybe HCAHPS, which wasn't necessarily the majority of your population. This was an underserved, undersurveyed area that you finally get some feedback from. Is that a good summary,
Yes.
you think?
Yes.
And like you said, other departments of physical therapy has resources and things to work on then as well. And then dietary now, like I said, that's the pilot. And so I don't want to let the cat out of the bag, but dietary getting feedback. Actual 3 questions on the dietary that Survey Solutions, like I said, is developing for across the nation, we're able to pilot. So think of that aspect of having some dietary feedback as well. That's been going on, I think, just since the month of July. So very new in that regard. Miss Katie, thank you so much for sharing your perspective. If you'll stay on in case people have questions for you, I appreciate it, okay?
Hey, Susan, just really quick, could Katie explain who in their hospital actually administers the survey? That's a question we've already gotten in chat.
Okay.
Well, normally under perfect circumstances before nursing school, I am currently in school, it was 100% me. So I have had to divvy that out to my social work department and case management department now takes up the slack on a lot of those duties, including those surveys.
And before your swing bed coordinator, right? That before nursing school.
Swing bed
and you still
coordinator
are.
and activities.
So the swing bed coordinator typically is the one, I would say, across all of our 13 participants. That's pretty much the swing bed coordinator does it. So 1 or 2 kind of a backup folks is who typically is administering the survey. I think other hospitals tried to do like every nurse training and it just kind of fell through the cracks. And I'm afraid that's what Katie's experiencing now, is some falling through the cracks when multiple people are responsible, kind of know what's responsible. So other thoughts? All right, Miss Katie, thank you so much. So stay on in case you have more questions. All right, so offering the opportunity, what does it really look like? You know, we emailed invites, we do an informational webinar with survey solutions so that people can actually hear from those folks and see if, you know, it's a partner they want to be with, not just us, but survey solutions. We email a participant agreement, so they do have to sign up, you know, sign on the dotted line. Their CEO has to sign, so they're aware that they're going to be participating. They have a business associate agreement with survey solutions. We held an informational project webinar so that everyone was kind of on the same page that was going to be doing it. Provide a deadline for the participant agreement, and we do have them do a $250 participation fee. Really offsets the tablet is the main thing that does, because there is that startup cost of tablet. And then emailed out, you know, kind of our recorded information, webinar links each time. Every time we do a huddle, that's kind of one of the things that rolls out. And so we did it, of course, for the informational webinars as well. Did a kickoff webinar with survey solutions and do coaching calls 1 week before they start, just to make sure, what's your process? Who's going to be administering the survey? Who's going to be reviewing the outcome? How often are you going to share it? Who are you going to share it with? So that they have a good process in place. And they may need to change once they try, but definitely giving some feet to the fire about a week before the start date so that they can make sure they have a plan in place. We talk about the dashboards, like I said, who's going to do them, who's going to log in, who has login information, who's going to participate, and where are they going to post. They're continuously updated, so every night upon the midnight hours when they update them. We do our monthly huddle, like I said over and over. Survey Solutions actually attends and listens to our people, listens to the feedback. They've even changed some wording. They now have someone in place that's even helping them rewrite some of their questions. So you know, they've really taken to heart some of the feedback that our people have given. And then, like I said, I do a little reminder with some homework reminders and the recordings out to all of our folks. So we do this monthly. You know, of course, we've had challenges of COVID-19 and staffing here and there of people that can't participate in the monthly huddle. But typically, I'd say if you can't attend, like if Katie can't attend, she'll send me a quick email with a summary. You know, when they get the reminder, they'll just reply to me and say, hey, I can't attend. Here's what's going on in our swing bed program, and then I'll share that on our time together. So really, what is your hospital, if you're going to do this as a group, what are they really committing to? So they're going to have to do some training with Survey Solutions to even see how the model works, to see how the tablet works, you know, how does the dashboard look. They need to make sure they have staff time, they have provisions of actually being committed to this project. Again, like I said, making sure that they have a process in place, and those folks that could actually administer and do the follow through, that they actually can develop and commit to actually doing something with the data. So we've talked earlier today about you know, moving towards improvement, continuous improvement, and actually doing something with data, capturing the experience, actually doing the survey itself, and sharing the data transparently. They do share in our state, part of the participant agreement is that they'll be transparent about all of their scores. Before Survey Solutions even had dashboards, I would take the data and I would make graphs, and they were all open and transparent about who had what scores. And that's some of the best networking that we had, because they saw maybe Katie was doing great in activities and Jada needed help, and so that they could network then offline or even together right then. We do learning and networking opportunities with other states. Right now, that's part of our Quality Innovation Lab. So we're working with you know, other states even on quality measures. And so we throw in a little patient experience here and there, which is nice. Our people who do patient experience are also doing some of the quality measures, and so they can kind of cross over, and the data that's shared there. Participating in that monthly call or webinar during the project is certainly part that they're committing to as well. And then, of course, what do we provide on our side? Special pricing. There is a pricing a price point with Survey Solutions that kind of is the group pricing. Assistance to hospitals, kind of the helping them set up an internal process. Maybe they haven't had to do that before, or work through kind of a PDSA challenges and those types of things. Technical assistance and coaching. I would say, like before y'all got on, I even asked Katie, hey, Katie, who's doing your surveys now that you're not on? Because I can tell that their numbers have decreased. And so we even had a little coaching call before y'all joined the session, just because I was touching base with her. And so I say that that's a big thing that we offer as well. Facilitation of peer networking. Our group emails each other about, hey, how are you all doing this? Or what about this, even outside of the patient experience or even the quality measures. And so our group really has taken to heart that whole peer networking and embracing each other as resources. And so we analyze the data, we talk about it, we get them together, we work on quality improvement. If somebody, if the majority are kind of decreased in activities, we have one that's doing great in activities. I think Onega, one of our hospitals, came on and they've presented, how they did their activities program, and other people embraced it and loved it. And so I just think that we're utilizing even our own internal expertise at these hospitals based on their scoring as well. Comparison and aggregate to this project, of course, never sharing outside about specific hospitals, but we do share internally in the state. That's something that, like I said, they agreed to. And then, of course, at the end of any project, if they're only on for a certain amount of time, we would do a wrap up. I will tell you, nobody's leaving. So we've added people. If anything, we've added more hospitals who've been interested over time when we did our state rollout. But I haven't had anyone quit or decide that this isn't a great work group. So and a great opportunity to get the feedback that they need. What does it really look like? They have to set up the training. They have to establish an actual process to do it. They have to start surveying and actually do the surveys. They have to check the dashboards for results. They need to attend the meetings or at least listen to the trainings, the actual Zoom recordings, share their data, share it out so that everyone actually is doing the thing, and then make improvements, actually put a process in place. That's what it really looks like. All the technical components of it, that's really what it boils down to. They actually have to give the survey, and then they have to do some improvement opportunities with it. Quickly, I just want to go into lessons learned, and I think that I just have a few more slides to kind of share with you before we can open up with some questions. Really, lessons learned, that pre-participation coaching, that making sure they have a process in place is pretty vital, versus just, yeah, we got our tablet, and then the day that you want them to start giving it out, that, oh, I don't know who's going to do it or how often they're going to do it. The monthly huddle calls, pretty important. Tablet versus paper. So, whilst I said they do come on tablets, I have in front of me what the paper version actually looks like. And for some of our population, they're more comfortable with a piece of paper. So they're able to still have a piece of paper if they so desire. Also for infection purposes, for a while during COVID, everybody got a piece of paper. And then our people were putting it in, okay? There's a Spanish language paper version so that they could actually, we've actually talked about other languages that we might need to, transfer it into as well. The survey themes upon admission, we've seen benefits of them actually saying, hey, we want to get your feedback. At the end of your stay, we're going to ask you some questions about it. So while this stay is going on, we want you to kind of be cognizant of the things that are around you so that you can give us perspective before you leave. And they tell this to both the patient and the family member so that they're aware. Like I said earlier, they're doing it the day before dismissal, the majority of them, unless something happens that just kind of falls through the cracks. I'd say 99% of them are doing it the day before dismissal so that it isn't one of those rushed things. The vendor, Survey Solutions, has great flexibility. Like I said, they attend our meetings, they actually take to heart what we're saying, and then we actually have some good performance improvement opportunities across many departments. They're actually having solid things of data foundation, and that they're not having to go out and search for maybe a new project. These are actual perspective of the patients that have been part of their services that they can actually work on. Project successes, immediate patient experience information. We're not waiting weeks to get an HCAHPS perspective. These are specific to a skilled or swing bed program. timely improvement opportunities because of that, so that they can actually have, real-time improvement almost. They're getting that almost immediate feedback, to assess the patient needs, to allow for modifications in staff education, service recovery as needed. I mean, pretty immediate feedback is pretty valuable as well. Real relevant to basically our population is served then because of these types of questions. They make up our largest admissions here in Kansas, more so than in acute care. So the HCAHPs might not be meeting as many as this type of survey would. So great value for our critical access hospitals. Most were surprised at the price point compared to an HCAHPS vendor. I think that was surprising to people, that how reasonable it was. Reasonable, manageable for smaller organizations because of the rural relevant and the feedback and the value. I haven't had anyone quit continuing on to do it. I have a few that this will be the end of their year. We did our year rollout, and so some of them were asking how much it cost. But again, I just asked 2 weeks ago if anyone was thinking they were going to let their contract expire, and no one is. So the response rate, the number of people that they have, all of those things factor into the value for them. And with that, I will, Jennifer, I may have missed something, so please unmute and answer anything I may have missed, because Jennifer usually does that for me. And then questions. Matt.
The only thing I would say, another kind of lesson learned, is this is a project that we really let our work group design. And I think that has been a huge success point for us, because they are fully committed. It was their idea, and we're doing what they ask us to do. And that's not always the way that projects work. Sometimes you just bring, hey, we have this great project and we need you to be part of it. But they really helped us come up with what would be most useful. And I think that's how it really helped with the engagement side of it.
True. We've taken the same perspective of how this work group worked, and we've really started it with the rural health clinic work group as well, because we want them to drive that side too. So, Matt.
And I think the work with other states is,
Oh,
we're
yeah.
just starting to see how exciting that could be.
Yep. All right, Matt, questions.
Yes. Okay. Well, first of all, I'm not crying. I just had a really big yawn, and so it looked like I'm crying.
No, this was so
great
bad. How did I
presentation,
get stuck in here?
Did not move me to tears.
Okay.
Yeah. So, first question off the top of my head is, and I'll monitor chat. Please, guys, send your questions in. Is if I were going to duplicate this in my state, what would you anticipate would be the first few problems or challenges that our state flex program would have in rolling this out?
I think you're going to need some financial resources.
Yeah.
Okay.
For sure, to pay for the vendor fee. And I put in chat earlier, I don't know if everybody saw it, but for the pilot phase, we paid for everything, because we did not want cost to be a barrier to folks' willingness to help us figure out how this worked. So we paid for everything for about 18, almost 24 months. Because of COVID, we had to stretch it out a little bit more than we had originally planned. So I think that's an important piece. And you have to have a Susan-like person who can do the monthly calls and constantly stay on top of people and monitor what they're doing. That's what makes it different than just hiring a vendor and getting some survey results.
Well, we had the question too, to kind of follow up that financial thing obviously is going to come right to the top. What is the kind of ROI for the hospitals?
I don't know that we have a dollar figure. I mean, we've been trying to figure that out. We haven't, but for many of our CEOs, CFOs, we were afraid that they were going to say, this is not an expenditure worth our money. And so we had our pilot test group just take the price to them and say, what do you think? And they all said, if we can keep one swing bed patient, we've made up the money. So for them, it wasn't a big ask.
And so what about, another question just came in, what about like around a ballpark figure about what a state or a hospital would need per, to roll this out?
I mean, It's around 2,000 per for us with the pricing we got, and so I can't. This is a ballpark. I mean, honestly,
Everyone's going to be different in every
right,
state.
about 2,000 per hospital for the full 12 months, and you know what I mean.
That's for the survey, and
Yes.
then on top of that, we have costs for as part of Susan's contract for facilitating.
True. Sorry about that.
And I don't think anybody here is going to, be surprised by that number or, like expect it for free. So I think that's good to kind of have a holistic approach. Like you gotta get the hospitals on board in one. You got to get funding for it. You got to have, the actual survey. Then you got to have the support to read the surveys and, put it together in a format that matters. And so, so, yeah, that's a really great. Was there any pushback that you did outside of the financial aspect or outside of the normal day-to-day stuff of convincing hospitals to come on board? Was there any pushback that you got that you didn't anticipate?
Pushback, no. I think we were both surprised when we opened it up. We thought we were going to be turning people away. We said we had enough funding for 25 hospitals, and we didn't use it all. I mean, we still have slots. So we have a very committed small group, but obviously we have a larger group of hospitals who haven't quite caught on to maybe why this is something they should really be doing.
Well, hopefully the results that you guys are showing now and the benefits that you're showing now can help increase other hospital involvement. So along that lines, you've mentioned your successes and some key points there and things like that. And so what were, moving into the future, what is your measurable outcome here? Not like your outputs, but like what is the actual like tangible goal at the end of this? Like what do you hope these hospitals do differently once you guys are no longer around doing the surveys? What do you hope? And maybe that's even a question for Andy or the state, but what do you hope that they do now?
Well, the big picture goal of our group was to grow their swing bed programs overall.
I was going to say, I hope that they use the results, and I'm going to go back quickly. I hope they use the results and actually utilize the marketing material to build their resources, to build their patient base. You know what I mean? If they have, referral sources that don't even know what a swing bed program is, we've got some education. I mean, that's my hope, is that they're actually getting more patients and able to keep more of their patients at home, near home, so that they can have more visits. And that's my hope. How's that measurable? I got to work on that one. But
when we started this, bundled payments were still a hot topic, and there was a lot of fear among many of our small hospitals that they were going to lose those swing bed patients that normally came home after a hip replacement or somewhere, because the referral hospital would be looking for the most inexpensive option. And they wanted a way to articulate that they really are, on the whole, a better option. So we're also picking that up on the quality side by being able to show our lower rate of readmissions and some of those other things that we can use to compare ourselves to some of the SNFs.
Okay, no, that's great. Nick, you got another question?
Yeah, not a question as much as a comment. So I've been trying to get my hospitals to work on swing beds for a couple of years. And I know, anecdotally, that the quality is better at the critical access hospitals because the doctors are on site, nurses are a little more highly skilled than a nursing home staff. But when I asked about the return on investment, I know if these hospitals can keep some of their patients that go to nursing homes, they're definitely going to do better because they don't even have to change locations. They just got to educate the families on swing beds. And then the other thing, Susan said, if the activity or the outcome is you want them to get more patients. I mean, the way that I want to measure it is do something, and then if they have an increase in their census after that, change or the survey, you could say, hey, this is most likely due to more patients or more referral sources hearing about these great results, and the census could go up by 1 or 2 per day or 3 per day or whatever that number is. And then that translates into how much more money is going back into the hospital.
Right. I think those are great points. And yeah, that's what these outcomes, this idea of was there a number tied to it, not a financial number, but like, hey, we want to increase attendance. Sorry, that's been on my mind for days. We want to increase swing bed, admittance to X amount, or to pull that from the community. I'm sure the data is there to support that. Like, how much of the market share do they have? What's going on? So yeah, I imagine this can be different for every single hospital.
And in the quality measure side, so of course, like I said, this was our first layer of the onion because it was low hanging fruit. Survey solutions already existed. It took us a little longer to get our quality measures going, which I think we started that interestingly in September of 20. So, you know what I mean? We did a full year of this, then everybody was ready to go with quality measures. But they certainly have the data. They have the base data then of, length of stay, every patient, did they return to their previous residence? I mean, all the things that we're gathering in the quality measure side would definitely be baseline data then that they could use once they start the marketing materials to see what their census is over time. So definitely an outcome.
Well, and Susan, we didn't share some of the open-ended comments, but it has been amazing how much you can learn and how easy it is to improve the experience for some of these patients. I mean, all sorts of things about some of the things you'd expect about food, but simple things like the socks don't fit right and they're uncomfortable, or, I mean, just amazing things that people have been able to do that are so easy to improve that overall experience.
Well, and let's talk about even the tertiary impact of having a new network or being able to form conversations with other hospitals and other things and be able to brainstorm that maybe that didn't exist before, or maybe it did, just not on that level. And so you have the patient impact, you have the hospital impact, but then you have this networking, which is not just personal, but it's also professional. And I know Terry had mentioned that, and Jennifer, you had mentioned that also in your conversation. So
when you talk about workforce and the satisfaction of people in an organization, one of the things that our people, when we have turnover in quality, one of their feedback is, I'm the only person like that in the hospital. I don't feel like I have any support. So this is one of those aspects where our swing bed coordinators actually have a network of 15 to 20 that they really feel close to, and they can reach out and say, hey, how are y'all getting this signed, or what's your new document, or do you have an example of this policy? And they're willing to share those things. So that support hopefully will decrease the turnover in those areas as well.
Right, and that collaboration can lead to other areas of improvement as well, not just swing bed, not the stat area quality improvement. And so that is obviously, again, a secondary, tertiary support.
Sure.
We have another question from Barbara. Is the swing bed coordinator a full-time employee or multiple hats?
Katie, can you speak to that for yourself, for your organization? Was it a full FTE for you to run that?
It used to be. When our census was a little higher, COVID, we kind of took a hit on our census numbers a little bit.
Okay.
I still have like a 15-hour a week budget on that, but it's not
the full 40
at this time.
Barbara, I would say most of ours are multiple hat wearers. You know what I mean? They're not just a swing bed coordinator. They are, maybe a discharge planner. You know what I mean? There are other things for the rest of the organization as well.
Infection prevention.
Infection prevention. I was going to say it varies which hat they're, which organization, how many hats they're wearing. But I would not say the majority of our places have a full FTE for a swing bed coordinator.
Too small. Yeah. Okay. Well, this has been absolutely fascinating to me, and I'm sure to everybody that has been in here. And so I want to thank Susan, and of course, Katie, for jumping in, Andy and Jennifer. You guys have been phenomenal. This is really good information and really good experience that I think we can all take away, and even not just from swing bed, but from maybe some other points of view as well. And so if you guys have further questions for any of our presenters today, feel free to email them, message them within this event platform, reach out to them in any way. This presentation, as all of our presentations, will be, I'm sorry, I just got tongue-tied, will be able to be replayed on demand on this event website pretty much immediately within about 30 minutes. This presentation will be. The other ones are already on this. So if you want to go back and review or watch the other breakout groups, you can as well. So thank you again to Kansas and their team for joining us today. Tomorrow, we are going to wrap up right here in this room. Tomorrow, we will meet back in the main attendee hub at noon, where we will have a rousing presentation from Fort, as well as a few hear from Tom again. We're also going to do a little bit of a celebration and recap tomorrow throughout the day of the 25 years of Flex. So that's going to be really great. We've gotten some awesome feedback from some people that have been long-termers, so to speak. And so we'll be doing that. We're also going to talk about core competency updates and how that might impact your state and any changes coming your way for that. Plus, of course, breakouts and a lot of fun stuff coming your way. So please join us. If you want to do instant networking, please do instant networking and come back and tell us how it is. Stay on, go to there, a little roulette, find out who you end up chatting with for 5 minutes. You can always just hang up if you don't like them. But I would love to see how it goes for you guys. That's open for like 30 more minutes. But yeah, other than that, we're super excited that this thing is rolling. We're kicking off. We got 2 more days of really great material. We really appreciate you all for being here. Thank you again for our presenters, and we will see you guys tomorrow. Thanks so much.
Thanks, Katie. Bye, everybody. Thank you.
Bye. Thank you, Matt.
Bye,
Thanks for
Andy.
attending. Bye, Susan.
Bye.
Bye, Jennifer. Thank you, Katie.
Okay, thank you guys. I'm going to close the room now and save the chat. Oops.